I want to thank you all for continuing to tune in to these press conferences. As a reminder, starting today, these are no longer daily pressers. It will be Monday, Wednesday, and Friday, every day at 1 o'clock. Monday, Wednesday, and Friday, every day at 1 o'clock. If you would like more frequent updates, I would encourage you to go to the governor's website, governor.ri.gov, and sign up for our daily COVID emails. Thousands of people have done that. You'll get an email every day, and it'll provide you with up-to-date information. Okay, we'll begin as we always do. We'll put the data up on the screen. As you can see, more good news in the data. The numbers are continuing to trend in the right direction. Yesterday, we saw 51 new cases. I remember it wasn't that long ago I was up here and there were 300, 400, hundreds of new cases a day. We are now testing more people, and I'm here to report only 51 new cases. So that should give you some confidence that we are continuing to have a stable situation and doing a very good job dealing with the virus. I will say I have to report, unfortunately, an additional 10 fatalities. And Dr. Nicole Alexander-Scott will talk about what we saw over the weekend. As good of a position as we are in, let's just bear in mind that every single day, Rhode Islanders continue to lose loved ones to this virus, and so we all have to continue to be vigilant and aware and alert. Okay, I have a handful of announcements today that I'd like to get through. I'm going to begin by starting with a quick announcement related to the Crush COVID RI app, Crush COVID RI. I want to first acknowledge Chirag, who's on my team, who's here today, in case anyone has any detailed questions. He and his team have worked 7 days a week for months to make sure that we could have this app for the people of Rhode Island, so I want to thank them. I want to let you know that as of today, a new technical improvement to the Crush COVID app is available for download at the App Store and Google Play. We are calling this version 1.5. It's not quite the version 2, which will roll out in a few weeks, which will be the final version. We're calling it version 1.5. It's got some improvements to it, a little bit easier to use, on an Android phone, and the location diary, a few changes have been made so that it is more accurate, and particularly accurate on Android devices. So I would ask you please to take a second to go today and download the new app, the updated app. I did it this morning. I think it took me 10 seconds. So download it. If you haven't yet downloaded the app, we have about 46,000 users. I'd love to get to 50,000 by the end of the week. So if you haven't yet downloaded the Crush COVID RI app, please do that, Apple Store or Google Play. If you've already downloaded it, take a second to download the new version. Version 2 of the app, which will have additional features and functionality, will be out by the end of this month, by the end of June. And that is the version that we are going to call the final product. So this isn't something that we're going to continuously update every month or every couple of months, but it is something that I'm asking everyone in Rhode Island to download, to use. It logs your symptoms. It'll allow you, if you test positive, to quickly see where you've been, and it's really an excellent thing for all of us to take advantage of. Okay, this afternoon, most of what I want to talk about relates to testing. I have some new announcements related to testing. So first, let me tell you where we are now, where we've been, and where we're going. Testing continues to be a critical piece of the puzzle as we all deal with fighting the coronavirus crisis. Earlier this morning, I was on a call with all the other governors and the White House and Dr. Birx and the CDC, and they continue to emphasize to us the importance of testing. And so I want to share with you where we are and where we're going. Here's the good news. Right now, Rhode Island is the best in the nation when it comes to testing. We are a national leader, arguably a global leader, as it relates to our testing. We have the highest rate of testing per capita of any state in America. We have now tested just above 15% of our population. For comparison for you, the national average is about 5.5%. So we're about 3 times better than the national average. For the past week or so, we've seen a percent positive rate that is below 5%. And for the past few days, we've been below 3%. Now, that's a lot of numbers, and you might be saying, what does that mean? So at a month and a half ago, when we were at the height of the crisis, our percent positive rate was well over 20%. So we were at a point where we were testing fewer people, and we had like a 25% of the people we tested were positive. Today, we're testing many more people, and less than 3% of the people we're testing are positive. Furthermore, you might recall there were some big crowds around Memorial Day, and we had been wondering, would we see a spike? And at least as of now, which is when we'd be seeing the spike, a couple of weeks after, there has not been a spike. So, this is the kind of thing we have to be constantly vigilant and constantly looking at the data, but this is all good news. This is all good news. We're testing more. Testing's more available. We continue to test in communities, Central Falls, Providence, Pawtucket, Woonsocket, that are hardest hit, and we continue to see the test positive go down. Why is this happening? How did we get here? We were one of the first states to establish drive-through and walk-up testing sites, and I want to thank the National Guard for staffing those sites. We were one of the very first states to use the rapid testing machines, and we were the first state in America to partner with CVS, our local company, in order to have large-scale rapid testing. And again, thank you to CVS. We have put testing sites in communities that are hardest hit, including walk-up testing sites, out of recognition that not everybody has a car. And we are continuing to do that. We're going to continue to expand. So everything we've done from the beginning until now has been to have a high volume of testing and to make sure everybody could have access to that testing. Now what we want to do is keep that high volume, but our emphasis is not just a lot of testing, but smarter testing. It's testing smarter, not just testing more. That's where we're going. So, what does that mean? It means testing in ways that give us information about where the virus is so that we can react to it quickly. We have a 3-part testing strategy. Part number 1 is we want to be able to rapidly test everybody who has symptoms. If you're feeling sick, if you have a fever, aches and pains, trouble breathing, etc., we want to make it so that you could be tested quickly and have your test results within a couple of days. We are doing that now. We have met that goal. We are continuing to meet that goal, and we will continue to meet that goal. That is not easy, right? As more people go back to work, kids are going back to camp, kids are playing sports, we're going to open school, more people are going to get sick, so we're going to have to keep increasing our volume. Our commitment, my commitment to you, is throughout the rest of this crisis, if you feel sick, you can get tested and have your results within a few days. That's part 1. Part 2, we need to be able to quickly react to outbreaks. We know that's how the virus works. There will be outbreaks. maybe in a nursing home, maybe in a manufacturing operation, maybe in a school when school's open. We know there will be, outbreaks. Our commitment to you is that our team can be on the site of an outbreak within 4 hours, rapidly testing everyone who may have been in contact with the person who was infected. And we continue to do that. We have continued to do that. We're doing that most particularly now in nursing homes, but we've had to do that for a few workplaces as well when there was a concern about an outbreak. Then finally, and the piece I want to talk further about today, is we want to create and expand an early warning detection system by testing key groups of asymptomatic individuals. So people who aren't sick, testing people who don't feel sick at all in groups. Now, people have said to me, why do you want to test people that aren't sick, Governor? Because let me say this, from my perspective, I never again want to have to close Rhode Island's economy. That is a priority of mine. Having lived through what we've lived through in these past few months, the number of people who are still out of work, businesses that have closed, we never want to do that again. Our goal is to open the economy once. What that means is that if we do see an outbreak in a community, in a school, in a place of worship or work, we need to be able to detect that before it gets out of hand, so that our response is to clamp down in a limited way in that location. What happened all over the country before was that the virus got out of hand. It ran away with itself, and so we had to shut everything down. Well, now we shouldn't have to do that again, because we have the testing, we have the contact tracing. People will continue to get sick, people will continue to go to the hospital, there will continue to be outbreaks. But if we do enough testing of people who don't have symptoms, we can catch it early enough and then try to put a lid on the spread. And God forbid, if we have to close anything again, we'll close just a town, just a business, just an industry. So, to that end, we are beginning a new aggressive effort starting today to test asymptomatic people. Now, we will say this. It is a fact that the tests are not as accurate on people who don't have symptoms as they are if you do have symptoms. That's true, but they are still somewhat accurate, and some information is better than no information. And we have had many thousands of people test positive who don't have symptoms. And every time we can find a positive person and put them into isolation, we've done a good thing and reduced the spread. So nothing we're doing is perfect, but we have to use every tool at our disposal and do everything we know how to do in order to continue to keep the virus in check. We've already begun some of this asymptomatic testing, and I've talked about it here, most particularly in nursing homes. So we now have tested or offered testing to every employee at every nursing home 3 times. Our goal is to continue to test the employees of nursing homes once every week to 2 weeks, continuously, and that has gone very well. We're doing the same in other community care settings, in the ACI, among first responders. So we have already started this. But for this early warning detection system to be effective, and that's what it is, it's an early warning system, we need it to be more robust. So I would ask if you could now put up the slide which explains what I'm talking about. So you see a slide on your screen in front of you now, which attempts to lay out where we want to go with this early warning testing system. Starting today, close contact workers will be able to schedule a free test at one of our National Guard sites. So what am I talking about? Hairstylists, barbers, people that work at nail salons, gym employees, people that work in a tanning salon or a tattoo parlor, massage, etc. If you work in one of these, what we call close contact businesses, and you don't feel sick, we're encouraging you, please, to go get yourself a test. It is our goal to be testing 900 people a day who are asymptomatic. We're also opening the asymptomatic free testing option to education workers, starting today with child care employees. If you fall into one of these categories and you're willing to go be tested, even if you don't feel sick, you can, as of today, you can go to portal.ri.gov, or you can call the Department of Health 222-8022 and schedule yourself a test at one of the National Guard sites. So our goal, as I said, is to be ramping up to 900 people a day. These are people who do not have symptoms, who work in these industries, so we can just get a feel for the prevalence of the disease in those industries. We want to, yes, and we're going to continue. The slide that you have in front of you will show that over time, we're going to roll this out. The next time we come back to you, we're going to be rolling it out to retail workers, manufacturing workers, when school opens up again, teachers, students, parents, higher education, URI, CCRI, and RIC, when the students come back. So today we're starting with education workers and close and contact workers. And I would just encourage you, if you work in one of those industries, you don't feel sick, it's free, it's easy. You can schedule it yourself at portal.ri.gov. Go ahead and get yourself tested. It'll just give us data to know what's going on in those businesses. I would say this. I've talked to a lot of business owners, barbers, nail salons, et cetera, restaurants, and what they're saying to me is, Governor, people are afraid to come back. And I think that's natural. It's going to take time. Everybody's going to come out at their own pace, and that's appropriate. But if you are a business owner, it's probably in your interest to encourage your employees or yourself to go ahead and get tested, because it'll allow Rhode Islanders to have confidence. If we test a couple thousand hairdressers and the test positive rate is extremely low, then that's a good thing to know. These are all things that we're doing to contain the virus, but frankly to get confidence back among the people of Rhode Island that it's safe to go to church, safe to get your hair done, safe to go out to dinner, safe to go back to the office. So the last thing I'll say is throughout, and this is on the slide, throughout all of this testing, we're going to continue to emphasize additional testing in communities of color and in high-density communities such as Central Falls, Pawtucket, Woonsocket, North Providence, areas of Providence. This is what we really have to keep our eye on. And so, that's a lens that will cut across everything that we do. The CDC, this morning I was on a call with Dr. Birx. We have done all of this in consultation with the CDC. This is what is being recommended to us as best practices for early warning testing protocols as we go forward. So I'm happy to answer questions on that. It's a lot of information. It also took an enormous amount of work, and I want to thank everybody who enabled this to happen. Okay, a couple of other things that I want to mention. Obviously, over the past couple of weeks, we have had large protests, people gathering, mostly peacefully, in very large gatherings. exercising their First Amendment rights. I feel very proud of the people of Rhode Island as I stand here this morning. In the past probably 10 days, week to 10 days, we have had nearly 20,000 Rhode Islanders across more than a dozen different protests in communities and towns coming out to peacefully exercise their First Amendment rights. I want to first thank every member of the community, the community leaders who organized these dozen or so protests. These are never easy to plan. You worked extra hard to make sure that they were planned and that they were peaceful. So I want to thank you for that. On Friday night alone, they estimate over 10,000 people came out to Providence to demand change. And it was by and large, a peaceful event. So to all of you who came to protest in peace, to the organizers who were urging action and anti-violence, I want to say thank you. And to the many, many members of law enforcement and the National Guard who exercised discipline and restraint and professionalism, I would like to thank you for keeping us all safe and for keeping it peaceful. As some of you know, I did not go to the protest, although I said I supported. I was reluctant to participate in something that clearly violated the social distancing rules. I did go out late in the night when things were getting particularly heated. I went out and I spoke with the protesters. I did that because it was clear to me that there were people there who felt they still hadn't been heard. And so I went out to make it clear that I am listening, I am committed to action, and frankly, I went out to de-escalate what was a very tense situation. The night ended peacefully, and so again, I can't thank you enough for participating in that. I also am proud of the nearly 100 employees at the protest. We were there handing out masks. We were trying to follow the rules, using hand sanitizer, staying with the groups they came with, wearing masks. So I want to thank all of them. I would say this, a few things. If you were there, and I know there were a lot of young people there, which is great. It's always encouraging and hopeful to see young people come out and take a stand. For the young folks who were there, my daughter was there, some of her friends, please take extra caution not to be around older people or sick people or people with underlying health conditions that may be in your house over the next couple of weeks. We are also encouraging anyone who was at one of the dozen protests to go ahead and get tested. Again, you can go to portal.ri.gov to schedule a test. My husband and daughter and I are going to get tested later this week. Dr. Nicole Alexander-Scott and members of her team who were there passing out literature. We are all going to get tested this week. And of course, if we test positive, we'll go into isolation. So I would say if you were there and if you have folks in your family who are sick or older or vulnerable, please exercise extra caution. And if you were there, even if you're not feeling sick, we now have this new way that you can just schedule a test, portal.ri.gov, schedule yourself a test. We know that the tests are most effective between 3 and 7 days after you were exposed. So maybe today, tomorrow, Wednesday, Thursday, go online, schedule yourself a test. It's better to be safe than sorry.